It's a real missed opportunity. Around the country, increasingly, traffic engineers are finding that it's a no-brainer to go from 4 lanes to 3 because there's no loss in capacity and there's a lot of benefits I just mentioned to going from 4 to 3, and it's often simply a restriping process, which is rather affordable. And so it's a missed opportunity, frankly, to not go from 4 lanes to 3.
So these road diets are really a tool that's virtually has no expense, because unless you're having to mill and overlay because the road is in poor condition, it's just a matter of reallocating and then re-educating to get into it, right?
Right. You have modest costs. You have modest costs for dramatic improvements, and yet you can also count on those big retail and big sales improvements, or big sales benefits and big sales profits increase, community benefits from increased sales, increased dollars. You can also count on inducing much higher levels of civic pride. People become more proud of their street and their community when they see that kind of transformation. And so those big benefits far outweigh the more modest costs associated with going with a road diet.
Overall, what other benefits are there from Complete Streets?
Well, Complete Streets is a really powerful tool for promoting economic development. We now know that high quality of life is about the most effective way to promote economic development in a community. We know that higher quality, creative class type, well-educated people are looking for a high quality of life. They are more likely to be attracted to and retained by communities that have a high quality of life. And a complete street is a wellspring for higher quality of life because it provides transportation choices, more safety, and more civic pride.
What impact also do Complete Streets have on the health of the population?
Very important that we do things to promote community health these days. We are finding that across the nation we have an obesity epidemic, and health community people, health professionals increasingly are turning to us urban designers and traffic engineers and telling us to provide them with help and better design of communities to induce more routinized active living, like biking, like walking, like using transit. And a very powerful way to do that is to provide the complete streets where people are going to be very readily finding that they're walking more often on a daily basis and bicycling more often on a daily basis.
I've also heard it said that Complete Streets promote provincial American energy independence. That because we get people out biking and walking instead of making car trips, we don't have to buy as much gasoline. I thought you had made the point yesterday that a century ago Americans spent 1%.
Right.
Could you talk a little bit about that?
Yes. It's very telling that 100 years ago, the American household average expenditure for transportation was about 1% of the household budget. Today, it's about 20% and rising of the household budget on average that goes towards transportation. What we've done effectively is we've privatized transportation, that now the household is much more responsible for paying transportation costs, and that means it's very, very difficult today to provide affordable housing, because 20% of a household income going to transportation is very unaffordable for low-income households.
Telling point. What other impressions do you have about Topeka?
Well, Topeka, I think, needs to be concerned about the extent, again, of its roadway size. The sizes are excessive. It also has a problem, I think, with excessive surface parking downtown, underpriced surface parking downtown. When you have underpriced downtown surface parking that's excessive and is prominent in its location, that is fronting streets, and you combine that with, you couple that with really large roadways that you have in Topeka, you are essentially draining the lifeblood out of your downtown. The downtown, to be healthy, needs to leverage what I call agglomeration economies. It needs to leverage concentration, compactness, small distances, and surface parking and large roadways disperse and undercut the agglomeration economies that a healthy downtown needs.